Hello everybody, my name is Aida. I work here as well. And today I wanted to talk to you about seasonal allergies and my top 5 solutions for them. So just with a very brief introduction, about 20 to 25 Canadians are affected by allergies, which makes up about 8.5 million people, which is a lot. We see it all the time, and it basically is our immune system overreacting to something that would normally be benign. So things like pollen, molds, dust, animal danders, those are some of the most common triggers for seasonal allergies. And the symptoms that we see with an allergy of this type are things like a runny nose, itchy eyes, watery eyes, postnasal drip as well. Headaches is another thing too. Some people get very, very congested, and this can turn into a headache or just feeling very drowsy, very foggy and heavy overall. And it actually can be as bad to a point where people are just unable to function on a daily basis. And we do see people missing work due to an allergy, a seasonal allergy. Some people's is quite benign in terms of the amount of effect that it has on their daily life, but for some people it can be quite debilitating. Also, some people get some itchy palate or itchy ears, and usually you see it, or you hear people around doing that clicking sound. Usually that might be a person who has an allergy and they're just trying to scratch their palate. So I'm going to I'll briefly mention the way that we investigate this if somebody comes to us with this. Usually we go by symptoms, so we take a very thorough intake during the visit, and then based on that we can pretty much conclude that the person has seasonal allergies. But for some people who want to know specifically what they're allergic to, the best way of finding out would be through a skin scratch test. So they basically scratch your skin and they put a small amount of the suspected substance and then see if there's a reaction to it. And then based on that, you're able to tell whether you have an allergy to it or not. We recommend also that you get off of your antihistamines about 3 days before you do this skin prick test, just because otherwise you might be altering the results of it. And there are also some medications that can alter the results of this allergy test. So some antidepressants and also gravel can be another medication that you might want to stay away from prior to going for your skin prick test. In terms of causes, a lot of people want to know what could be causing this. So it's multifactorial. There's definitely many causes or risks associated to developing allergies. One thing that has quite a bit of research, and it's quite conclusive, people who are born via C-sections tend to have higher tendencies to develop allergies later on in their lives, or maybe even early in their lives. Also, we are seeing more allergies in developed countries. So there's the idea that the cleaner the environment and the more sterile, the more prone we are to developing allergies. And, we see it quite a bit in Canada and the United States, some of the European countries, but we see them less in places like Cuba, for example, or Thailand. Some early use of antibiotics can also cause that, family history of it. And also there is some research showing that babies who are formula fed and are not breastfed can also have a higher risk of developing allergies in their lives. Pharmacological options, as you may know, most of them, or the way that most people begin is with an antihistamine. So this will basically help you to reduce the congestion, the itchiness, the watery eyes. Unfortunately, the older ones tend to cause a lot of drowsiness in people. The second generation ones are less sedating, but some of them can still be sedating. And but also some of those can cause things like headaches, nausea, dry mouth, for example. So but there's people who don't react to them either. So at that point you really decide, is it better to have a dry mouth and a headache or relief of my sneezing, for example. There's also a combination of decongestants and antihistamine. So if congestion is a big issue for you, you can also get combinations of that. And then, of course, there's corticosteroids. That is something that is an option for some people as well. And immunotherapy. So basically, putting you into contact with some of the substances that you might be allergic to. And this is usually an option that people take if they just cannot really control their exposure to these substances, or if they've just tried many things and it's just not working, so they have to move on to something else. So now let's talk about why we're here. So how do naturopathic doctors treat allergies? So first things first, lifestyle measures. So things like checking the air quality index for that particular day that you need to go out. Sometimes different hours of the day tend to be more saturated with the pollen that you might be sensitive or allergic to. So try to avoid going out during that time. If you're mopping your floor, for example, use a wet mop instead of the dry mops. Change the filters in your vacuums if you have carpets and rugs. Also, one of my favorite things to recommend to people is to also surround yourself with plants that tend to purify the air in your home. And there's quite a few plants that do that. I'll mention some. Some of them I'm not familiar with what they look like, but I have them here. Areca palm, bamboo palm, Boston fern, dwarf date palm, English ivy, lady palm, peace lily, rubber plant, and spider plant. Spider plant is really, really popular. And also, if you have a ragweed allergy, try to avoid cantaloupes because they have a constituent, a protein in it that's very similar to ragweed and could be contributing to your symptoms as well. And incidentally, usually people eat cantaloupes in the summertime, and, usually people are suffering mostly with their seasonal allergies in the summertime. So who knows, maybe they're eating a lot of cantaloupe and that could be exacerbating their symptoms. So now on to my number one recommendation, and that is healthy bacteria. So there's quite a bit of research showing that when our healthy bacteria is not in an optimal position, we tend to have worse allergies than usual, or even a tendency to developing allergies. We also just start seeing things related to your immune system. So getting sick more often, for example, and some digestive issues, as I'm sure Chris mentioned. So in this situation, what I would recommend is start introducing a probiotic into your diet. The second thing that I really like is flavonoids, which are the substances that are responsible for the colors in some of the fruits and vegetables that we're eating. And it's usually the yellow and the orange color that we see in our fruits. So we see it a lot in berries, we see it in legumes, onions, citrus fruits, red wine, green tea, parsley, sage, tomatoes, pears, apples, and bee pollen. So eating a lot of those fruits and vegetables can really, really help to alleviate your allergy symptoms. And another option that you have if you want to take it a little bit further and start supplementing with something is quercetin. So quercetin is a flavonoid that works by inhibiting histamine. So therefore, it reduces the symptoms like the sneezing, the itchy eyes, the runny nose. And it's quite very easy to find, inexpensive as well, and you can introduce that if you'd like to try that. And one of my favorite things for the relief of allergies is nasal irrigation. Has anybody ever tried, or is everybody familiar with the neti pot? Yeah? Okay. I brought one here just for those who haven't seen one before. This is basically a neti pot, and you would fill it up with a saline solution, and you basically just run it this way, and then you start seeing the water running through your other nostril, and then you would do the same thing with the other nostril. One of the tips that I recommend to people is actually even adding a little bit of probiotic to the saline solution, especially if you're prone to getting sinusitis, like sinus infections from your allergies, which is also quite common. And another thing that I like doing to your saline solution is definitely working with somebody that knows how to use herbs, maybe adding a little bit of an antimicrobial tincture to the solution. Again, if you're prone to developing infections, and then that works quite well as well. So it's good to, talk to your naturopath or your herbalist and see what they would recommend based on your specific situation.
When you say probiotics, you just empty the pill?
Yes. Yes. And some of them actually just come in a powder form, so you wouldn't even need to open up the capsule. Yeah. And speaking of herbs, one of my favorite things, also my go-to recommendations for allergies are herbs. And in terms of the actions that you're looking for when you go out and look for a plant that will help you with your allergies is an expectorant, for example. So if your cough is also one of the symptoms, so that would be something that you would want to have in a plant, an anti-inflammatory herb, and also something for immune support would be very helpful. Also an anticatarrhal, which basically is something that will help with all the congestion, all the mucus that you're producing. My favorite botanical, I have a little sample here for allergies, is nettles. Has anybody experienced nettles? I'll pass it around. It has a very kind of nutty flavor when you make a tea with it. So I find it very pleasant. It has like a nutty, grassy flavor. And I find it to just be very, very quick acting in terms of the relief that it provides people with allergies. So you can drink as much as you want. Usually I recommend making a bit of a strong tea with it. So about a tablespoon per cup, just to make it nice and strong. And it can have very fast effects on the allergy symptoms. It's also quite inexpensive and very easy to find.
My husband used to get really bad allergies, and a naturopath recommended he start in the winter having that every day. And then the spring came, and he was like, it was a miracle. Yeah. Like he had he was doing other things, but he really thinks it helped.
It's amazing. It's really one of my favorite plants for allergies and for many other things as well. And as you mentioned, one really good way to go in terms of managing your allergies is actually starting early, like her husband did. So start around the winter time, so that by the time that spring comes and the symptoms would start to appear, you're most likely going to feel a difference from the year before. So now would be a good time to get started with those teas. So especially if you're into teas, you just simply substitute what you're usually having with the nettle tea, or you can even combine it if you'd like. And another very, very good tool that we have as naturopaths for the treat or the management of allergies is homeopathic remedies. For those who are not familiar with a homeopathic remedy, most of them come in a pellet form in a little tube like this, and you basically would open the cap, like you just twist it, and then the little globule would come out, and then you'd put it under your tongue. So there's quite a few remedies that are helpful for allergy symptoms, and having a very good idea of what your particular symptoms is very important when choosing a homeopathic remedy, because each one will be for a different type of allergy. So I will go through my top 5, and so I'll start off with Allium CEPA, which is actually made out of onion. If you need this remedy, you basically have copious amounts of nasal discharge, and it's very watery as well, and it also irritates your nose. So those people that they feel that their runny nose burns their nose, this is most likely a good remedy for you. You also have a lot of frequent sneezing and very watery eyes as well. The next remedy is called Arsenicum Album. This one, both the nasal discharge and the eye discharge is quite burning. So if that's a characteristic of your allergies, this might be a good remedy for you to try. Also, if you suffer from asthma with your allergies, this might be a good remedy for you. Another very popular one is called Euphrasia, which is actually the one that I brought here. And this one is if your eyes are very red and very watery and they're burning and just very irritated in general, this would be a very good one for you. Some people actually describe having a sensation as if you have sand in your eyes. So this would be a good remedy for that. And of course, runny nose, intense sneezing, and a tickling cough would be covered by this remedy too. And another one is called Sabadilla. And this one is just very non-irritating nasal discharge and with a lot of eye irritation. And the last remedy that I wanted to mention is Wyethia. And this one is for people who just have very, very itchy palate, nose, or ears. This remedy would be quite helpful for that. And again, just take a look at what the main symptom is, or what stands out the most with your allergies, and then that's how you would be able to choose a homeopathic remedy that might help you. And some of the other things that we use once we're actually working with somebody and we want to have a more thorough treatment plan are things like acupuncture, more case-specific plants, and something called Gemma Therapy, which is also a form of botanical medicine, but instead of using the roots or the leaves or the flowers, we use just the shoots or the buds from the plant. So it's botanicals, and they tend to be quite helpful and effective for allergies. And that's it. Those are my top 5 recommendations for allergies. Does anybody have any questions?